Welcome. Here is a quick snippet about vitamins and minerals and stuff like that. ADEK, fat soluble. Everything else is water soluble down here. A, retinols. These are things from carrots and other veggies. Deficiency, you could lose your sight. Susceptibility to infection. A, eyes. D, bones, calciferol. Deficiency, hunchback, deafness, bow legs. This is important for calcium absorption. A lack of vitamin D, you have lack of calcium. And it's also used for other things too, some kind of a link to cardiovascular health. In the last few years, it's been shown that supplementation of vitamin D is helping to prevent things like stroke, heart attack. E, this is the sex vitamin supposedly. Tocopherol, get to know the brand, the letter names, and the other names. Antioxidant, and it interferes with, it has an interaction with warfarin. Vitamin K is part of the clotting cascade, and this is what warfarin blocks. So the vitamin K intake should be consistent. Don't stop it, but consistent taking it every day or every week. It also has been shown to assist in the bone density. B1, this is find out all of these things, where they come from. Lack of B1, thiamine, spelled two different ways. Beriberi is deficiency, and it's weakness, lack of energy. You also can have some encephalopathy and course, which is like sort of craziness. B2, riboflavin. Enzyme system, this is one of the electron carriers in the Krebs cycle. Deficiency, angular stomatitis. So some doctors actually prescribe this for people who have sores around the mouth and the corners of the mouth. Angular stomatitis, glossitis, tongue. And this will turn the urine yellow, where the B1, if you urinate after taking these B1s, it makes your whole bathroom smell like yeast, like bread yeast. B6, pyridoxine, cofactor in many biochemical reactions. Now, since B6 is important for normal nerve function, and people who are taking isoniazid, which is a product which is an anti-bacterial product for the tuberculosis bacterium, their structures are similar. So person taking INH, isoniazid, this drug will bind to the enzyme that's involved with the activation of dietary B6. So you can be eating all the vitamins, you can be taking food, but this will interfere with the activation of B6 from food, and then you might have B6 deficiency. So high doses of B6, like 50 to 100 milligrams every day with the isoniazid. Megadoses are bad. B12, cyanocobalamin, cobalt is in here. Cell growth, and makes the red blood cells grow. Deficiency, pernicious anemia, which is a hemorrhagic anemia. Megaloblastic, macrocytic, and people on metformin will sometimes, frequently, get this deficiency. Folic acid, this is another one of the products for normal biochemical reactions. It's not involved with myelin synthesis, where the B12 is. They both are used to prevent megaloblastic anemia, but this one is not involved with myelin synthesis. This one, if you're B12 deficient, it can actually affect your brain and your nerves. Folinic acid is the active form, which is sometimes prescribed with folate antagonists like methotrexate and trimethoprim and other things. Deficiency, here it is. Pregnant patients, 1 milligram a day to prevent tubal neural defects, which is a terrible deformity in fetus, in newborns. B3 is sometimes called niacin. Pellagra is the deficiency, big beefy red tongue. The 3 Ds, diarrhea, dementia, and dermatitis. So that's the nicotinic acid, or niacin. There are all the side effects for it. High doses can lower bad cholesterol, but it's very, very poorly tolerated. C is specific deficiency is scurvy. So it's ascorbic, no scurvy. And it protects the basement membranes. It can help build bones. It helps many, many other tissues in the body. And it is a water-soluble antioxidant. And if you don't have enough, you get bleeding gums, etc. And it's also used with some products to acidify the urine. Calcium, the citrate is better than the carbonate. You need a lot. You have to have it in your diet. We don't make calcium. Magnesium for bones. Phosphorus more for bones. Iron, black stools. Let me scroll up here. You're going to need, if you have iron deficiency anemia, you're going to need about 65 milligrams of elemental iron, which is in 325 milligrams of ferrous sulfate, 3 times a day. But it can constipate. The standard is ferrous sulfate, and there's some slow acting, slow FE, and there's a liquid, and keep away from children. It can be poisonous to children in high doses when they eat a bunch of their parents' vitamins. Potassium, very important cation in the tissues. It's good for the cardiac action potential. And bananas it has a little. It's 1 milliequivalent per inch. Trace elements, chromium has been shown to help along with the normal homeostasis of glucose. Cobalt is in B12. These are all trace minerals. Get to know them all. The copper, molybdenum, etc. Iodine for thyroid, zinc for eyes, etc. And here's your B6, B12, and folic acid. So it's pyridoxine, cyanocobalamin, and folic acid. It's big 3, which has been used for years on prescription. Even though they are not prescription drugs, they're prescription items that have those 3 with the thought that it may reduce cardiovascular problems. Then there's choline and inositol, which are lipotropics, and get to know all the rest of them. Now, when it comes to the herbals, this will be the next section. So this quiz this time will end right at the other nutrients thing. So get to know all these things. Get to know the water soluble, the fat soluble. Get to know the retinol with vitamin A, the bones with the vitamin D. E is antioxidant. K with the clotting. B1 thiamine. B2 angular stomatitis. B6 it's a normal enzyme. It's a cofactor in many biochemical reactions. And remember the isoniazid interaction, very important. Pyridoxine, vitamin B6, there it is, water soluble. B12 water soluble. Folate, all these are water soluble down here. Cyanocobalamin and folate are both for megaloblastic anemia. If they have a deficiency, they will get megaloblastic anemia. And the pregnant patients, 1 milligram of folic acid a day. Some doctors prescribe 2, and some prescribe only 800 micrograms. B3, niacin, nicotinic acid, the 3 Ds, and it can be harmful to the liver, especially in the elderly. Let's see, vitamin C deficiency is scurvy, bleeding gums. So many dentists will tell patients to take vitamin C, about 500 milligrams or a gram once a day for 6 months and see what happens. And usually the gums stop bleeding. Sometimes. Calcium, the citrate is better absorbed than the carbonate. So that's citracal with D is better. Magnesium, bones, and phosphorus, again for bones. Iron for normal hemoglobin, picking up oxygen and getting rid of carbon dioxide, etc. Watch the chelation. And the ferric is not used because ferrous is much better absorbed. And for every 325 of the ferrous sulfate, you're getting 65 milligrams of elemental iron. And there's the potassium. There's your trace elements: chromium, glucose, cobalt, B12, iodine, thyroid, zinc, eyes, even prostate and skin and healing. Zinc is used very, very frequently by doctors. They actually prescribe it. There's your big 3, B6, that's pyridoxine, cyanocobalamin, and folic acid to reduce the amount of homocysteine in the body, hoping to reduce cardiac problems. And there are many other nutrients. Get to know them all up until that section. And that's your snippet for today in just 9 minutes. Goodbye. See ya.